Dr. Natalie Marks, and we're here with another quick cup of knowledge. Joining me today is Dr. Griffin. He's a boarded radiologist and associate professor of veterinary radiology at Texas A&M University. Thanks so much for joining us.
Thanks for having me.
Absolutely. And we're going to focus on the world of radiology and imaging.
Sure.
And I think one of the biggest challenges to a lot of our viewers who are graduating students and new in the profession is maybe they don't feel like they have a great handle on interpreting radiographs and even instituting ultrasound in practice. So what would you say is one of the first ways that they can get a little bit more training in learning some of these skills?
Well, there's a lot of really good resources. First of all, it starts with a strong desire to learn it. And it's not easy. It takes work, time, effort. It can be frustrating. But it certainly is helpful to go into a situation where you can work side by side with somebody who's much more experienced at finding the various structures and showing you little tips. In the abdomen of a dog or a cat, for example, there are literally thousands of things we could look at in many different ways. And the job of an instructor in one of these courses is to help really distill that down into some very attainable objectives and then show you, as a participant, ways to make it work for you. And a lot of those ways are not things that you can find in a book. Mm-hmm. They require experience. And for example, finding the left adrenal gland in a dog, there are 4 or 5 different approaches I use, and it really depends on the dog. Mm-hmm. But the only way for a new person that is learning ultrasound to get that is to work with people who know how to do that. And that's what, here at Western Veterinary Conference, that's what we're able to do. The labs work really, really smooth. They're highly professional. There's so much staff and instructors involved that the participants get a lot of one-on-one time. And I'm actually able to tailor my instruction to their needs and their desires of what they wish to learn.
And those are held at the Oquendo Center, correct?
That's correct, at the Oquendo Center, and on live animals. And it's amazing to see the people who the light bulb goes off. Mm-hmm. And they say, "Oh, there it is!" And then the next thing I'll do, if they just found their first adrenal gland, for example, the next thing I'll do is say, "Okay, now take the transducer off of the dog and find it again." Mm-hmm. And we'll do that repetitively until they get to where they can find it consistently every time.
And for a younger associate who has that passion and really wants to learn about ultrasound, but maybe their manager or their medical director isn't as keen about bringing it in, what are some talking points or strategies that you feel where ultrasound really should be a part of daily practice?
Well, the way that veterinary medicine has changed in the last 20 years, it is an integral part. There are so many questions that can only be answered with abdominal ultrasound. And not only does ultrasound provide an opportunity for growth, and it's satisfying to get better at it and continue to grow, but it's something that generates income. Mm-hmm. And it also leads to other procedures that generate income. For example, if you can make the correct diagnosis of an abdominal mass on ultrasound, mm-hmm. This can lead to a surgery and thoracic radiographs. So oftentimes the income that is generated by ultrasound is a mere fraction of the total income that is actually brought into the hospital.
And this doesn't just have to be the veterinarian in the practice, correct? This is also a way to empower technicians who have interest in this.
It is. Generating the images is something that anybody can learn how to do, and technicians can do an excellent job of acquiring ultrasound images of throughout the abdomen of a dog or a cat. And then provide that to either their practitioners or to send off for remote interpretation by a radiologist in order to make the right diagnosis and then come up with the right plan.
And what about the practitioner who comes to one of these labs and gets very inspired, but they maybe can't go to the most elite level of machine? It's just too much of a jump for that practice right now. Are there some starting point ultrasounds that they can invest in and then kind of work up to?
The technology has changed so rapidly. You know, you think about just the personal computers. They started out as big and clunky and slow and with flashing lights and things that took up a whole room, and now they fit in a laptop container, and now, you know, in fact, we actually carry a personal computer around in our pockets all the time, our smartphones. And ultrasound is doing the same thing. So the big, bulky, clunky images of systems of yesterday are gone, and there are now, compared to what I learned on, there are handheld units that you actually operate off of an iPad that produce image quality that is superior to some of the machines that I learned on. So there are many good systems out there, and the technology, especially to make good images or recognizable images of the abdomen, is much more available and accessible.
And we're not just talking about ultrasounding abdomens here, we're talking about all parts of the body, and I was recently taught how to ultrasound an eye, correct? So I know we a lot of times think about fast scanning and looking in parts of the body for emergency changes, but can you elaborate a little bit more about some of the other ways that ultrasound can be used in general practice?
Sure. Well, the eye is a great example. So the diagnosis of a retinal detachment is pretty straightforward with ultrasonography. We do a fair number at Texas A&M of cervical ultrasounds for either evaluation of masses or evaluation of the thyroid gland and parathyroid glands. It has become part of our routine workup for hypercalcemia, for example. We do a fair number of musculoskeletal ultrasounds as well, and it's a great test for evaluation of injuries of the patellar ligament, for example, or the common calcaneal tendon. There are as many different ways you could go with ultrasound as ideas you have. We do a fair number of mediastinal ultrasound in order to evaluate whether or not a mass in the mediastinum is arising from a lymph node or a thymus. And it also, in innumerable cases, that's actually what lets us have a window to aspirate and obtain a cytologic diagnosis.
Which, as you mentioned, is just leading to more workup, correct?
Right. So then now we've got a patient that either needs surgery or chemotherapy or so forth.
And let's jump back, as I mentioned, to the fast scan. For people who are watching that aren't familiar with ultrasound, can you elaborate a little bit more about what that really means and how that can even be a starting point for people?
Sure. So the diagnosis of peritoneal effusion has really important clinical ramifications, whether you're talking about a trauma case or an acutely lethargic case with an abdominal mass, and it's easy. There are a few well-defined windows where the fluid tends to be most apparent, and you're able to identify it, and then in many cases too, that will tell you the most likely place to have a successful sampling of the effusion to decide what sort of effusion it is, and then therefore guide you on the next path.
And that could also be a different level of charging, correct, for your practice, where you're trying to justify bringing this machine in, and for somebody who's new to the world of ultrasound and adding this imaging, you would suggest having different tiers, I'm assuming,
Sure.
of how to charge for that.
Sure. I think a tiered approach to charging is very reasonable, and a fast scan or using ultrasound, for example, for a cystocentesis is a great lower tier, and the higher tier may be an examination of the entire abdomen. And in many cases, it's really good to do an examination of the entire abdomen, because when we're talking about geriatric patients that are sick, they oftentimes have more than one problem that's clinically significant. And in many cases, there was no clue on their lab work that they had this second problem. And so it helps us more completely assess the patient in a holistic sense and make sure that we're making the right decisions.
Well, thank you so much for what you're doing for the profession. Certainly, people can look to the Oquendo Center for more information and training on some of the labs and techniques you've mentioned. And I hope you enjoy the rest of the conference.
Well, thank you very much.
Thank you.